Hello and good evening, everyone. It's good to be back once again with you all. And welcome to our IVF webinar. And welcome, Dr. Ana Puigvert is with us. So, hello, Dr. Ana. How are you feeling tonight?
Fine, thank you.
It's good to have you here with us, and I'm very, very happy that you've decided to actually come here and present two topics. Of course, tonight we have the first topic on aging male and infertility causes, and I can already tell you that Dr. Ana will be back with us actually next week on Wednesday. Okay, so there are two topics that she's going to present. And as always, I'm your host, Caroline, and I also want to mention that my IVF ancestors, as you know, we are a part of European Fertility Society, and we come here every single day just to support you, to give you some examples of topics, but also amazing topics, and of course, topics that are definitely useful, but also to support you, to give you that opportunity to ask your own questions and learn a bit more from top fertility experts. And of course, Dr. Ana is definitely one of those top fertility experts. She's the andrologist at Reproclinic, which is located in beautiful Barcelona. So once again, hello to Dr. Ana, and thank you so much for agreeing to present this topic.
Thank you to you to let me stay with you.
Thank you so much. And of course, as always, just let me remind everyone that we will start with the presentation on our topic tonight. And afterwards, there will be a Q&A session. So go ahead, type the questions in the chat section. You can do it during the presentation as well. And Dr. Ana will simply answer them for you after the presentation. Okay, and I guess it is time to start our presentation, okay?
Yes, I don't see it. How can I have it?
It's right
Okay,
here.
thank you very
Perfect.
much.
Thank you so much.
Well, good afternoon. I am from Barcelona, and now we are very lonely because not everybody can come here with us. In Barcelona, we love to have people with us. So I put some of the pictures to remember you our city. Today we'll talk about aging male and fertility. And to talk this, we must know what is the beginning of all of this. No, the spermatogenesis is the mechanism in which sperm is product. It's produced in the testicles, and it needs to have 3 months to become from the stem cell to a mature spermatozoa. And the reproductive capacity to having the spermatozoa begins at the adolescence. Then we will wait for the hormonal response in adolescence to obtain their fertile capacity to have babies and to fertilize those seeds. That's the way how he's doing, and I think it's important to know how it goes. The testicles is produced, it have inside him a lot, thousands of seminerous tubule that are like this. You can have the fertility cells that help the stem cells to mature during 2 months and a half until 3 months, and having then the spermatid that will become a spermatozoa in this area, in the epididymis. And here you have a schema how the mature spermatozoa is. And these are the hormones that are produced and help to mature this spermatozoa. In our hypothalamus, we have the FSH hormone that activate the fertility cells and produce the spermatogenesis that we have seen. Also, we have the testosterone that helps the production of the spermatozoa through the spermatogenesis. And here you have the Sagrada Familia that need also a lot of years to 2 years to finish it. Then at 14 years old, we have the first sexual response with a fertile capacity. It's during the testosteronic response during the masturbation, how we can see it here, and the testosterone. So we have FSH, fertility cells, and testosterone that will help to have the mature spermatozoa. How we can think that the adolescents are becoming mature to have their own capacity to produce spermatozoa and then to fertilize. They have a growing up testicular size with the Tanner index. They have their first ejaculations. They start to have voluntary erections, no spontaneous erection. They have the response of sexual stimulus during masturbation, and then they will start having the ejection of seminal fluid with a spermatozoa. From 20 to 35 years old, we are already in the adult year. There are no more adolescents. And it is the optimal moment to have their best fertile capacity. After 40 years old, the concept of male old age is very important to take care, because we have said before that we must have 20 to 35 years old to have the best spermatozoid, the one who will have the most better capacity to fertilize. But that is true that man maintains her during all his life the fertile capacity, because they always produce a spermatozoid. But truth is that the genetic quality of this sperm is deteriorating, starting from the 40 years old. What is happening then? Then the maximum peak of seminal quality and quantity start going down from 30 to 35 years. Then they will have 15% of their fertility going down. At 30 to 40 years old, they will lose 30% of this capacity of fertility. When they will have 50 years old, 50% of them, they will lose this capacity of fertility. Always men produce sperm, but its quality play also a key role. That's not only to have a lot of spermatozoa, but what they are bringing this spermatozoa, what they are transporting this spermatozoa, that will be chromosomes and genes. Here you have, you can see how is the tubule, the seminerous tubule, where you have a lot of stem cells that are producing mature spermatids, that they will have the capacity to fertilize. When they are going older and older, they will still losing all this, and the tubulus will be thinner and thinner, because they will lose the possibility to have more stem cells. That is what you can see. If you see it before, they have a lot of them, and later on, in 40 years old, they are losing all these tubules. They are more white and here and here. Then 20% of the tubule decrease their spermatic reserve through the disappearance of mature spermatid. But when they will have 50 years old, they will lose 40% of it, and more than 60%, more than 50% of them. When they are older than 8 years old, they will only have 10% of this tubule that will have the possibility to produce a spermatozoa. And then you tell us, but how do you know all those things? Not only with the histologic study, we have made a lot of the Society of the Airway, the American Urological Association, made studies very serious with, for example, with the uterine population, that are population that came in the United States in this area at the end of the 19th century, 18th, 19th century. People who had been living only there, and they live, and nowadays even in these conditions, the same condition of the 19th century. They doesn't practice contraception. Women are very young during their fertility capacity, less than 30 years old. They have a correct sexual function with good exposure to pregnancy, and this is really very important. The exposure to pregnancy is the first reason to have a baby. and they studied 8,559 couples. And what they have seen, 30% less of pregnancy in men over 40 years old than in couples who was under 30 years old. So more order, less pregnancy rate. And this is the evolution of men. And this is also the same evolution of the fertile capacity of men. In this situation, they are the best fertile capacity, and older they are coming, they are still producing spermatozoa in less quantity, but more or less quality. In a study of the Massachusetts Aging Male Study, sexual aspect also they are also very important to have a good pregnancy rate, and they have a decreased exposure to pregnancy because there are more increase of erectile dysfunction, lower intercourse frequency, 2 per month when men are about 45 to 50 years old, and at the late ejaculation. So even they have less spermatids, less semirous tubule that will produce more spermatozoa, and even their sexual capacity will become worse. When we practice uterine insemination, we can see that you have, when men are more than 35 years old, they have a rate of 25% of pregnancy. But when they are older than 35 years old, less than 35 years old, the pregnancy rate are going up until 55. That's another study that demonstrates that older men have less pregnancy rate in only intrauterine insemination than the one they are younger. They have also an alteration of the seminal fluid. They are losing during the years the volume of liquid that the prostate produces, about even 1 milliliter from 45 years old to 50 years old. They have also a decrease of a count of those spermatozoa by 3.3% per year and age, and decrease of motility more or less 1% per year and age at the beginning of the 45 years old, and the sperm morphology, the physical aspect of the spermatozoa, 4% per year when they start having 50 years old. So we'll have oligospermia, that it will be poor quantity of spermatozoa, low quantity of spermatozoa, astenospermia, diminution of the motility of the spermatozoa, and teratospermia, that will have more head defects, mid-pieces defects, and a lot of tail defects that also will explain us the alteration of the motility of these spermatozoa in older men. The men always produce sperm, but equality is still play a key role. Because nowadays we know that over 40 years old, about 55 mutations will pass to the offspring. So will grow up genetic alteration also. How we can see it? We will have more DNA fragmentation index in sperm, aneuploidies that must be studied with the biopsy, testicular biopsy, and this would explain the couple infertility and the no fertilization in IVF. Then we'll have recurring miscarriage associated with miscellaneous chromosome abnormalities. Here you have normal ADN, and here you have ADN of the spermatozoide fragmented. So no fertilization possibilities. Also, hormones will change. The men more than 50-year-olds will have partial or total testosterone deficit syndrome, increase of FSH, that will explain us alteration of the production of the quantity of the spermatozoide, also an increase of LH. that will explain you alteration of the testosterone. And older men will have also associated pathologies like diabetes, hypertension, cardiac pathology, respiratory pathology, eventually urological pathology. They will take more medication, then will have more endocrine disruptors that are very toxic for the fertility possibilities in men. And then in older men, they will have longer exposure time, so exhaustion's toxic factors also. So keep care, because with advanced age we'll have in men, fathers over 45 years old, more risk of schizophrenia, increase until 47%, of rageful autism also in 80% of these kids. So that's very serious and very important to take it in case. Epigenetic alteration associated with age is increasing in newborn with DNA fragmentation alteration, increase in new genetic mutations, and they will have higher correlation sperm DNA fragmentation with the fibroblast growth factor receptor. That it's a gene that can produce another very serious illness. Then we'll have trisomies, repeated abortions, childhood with fibroblastic leuemia that we have seen here behind with this fibroblast growing factor gene, and autism and schizophrenia, as we have told before. Then what we must do? When one person that have more than 45, 50 years old, men that want to have kids, must be visited by an andrologist in a Reproclinic center with a medical and clinical history, with a physical examination and risk factor detections. The general screening, we start with a sperm study, hormone evaluation, and very important, the index of fragmentation of those spermatozoa, because they will tell us how is the possibility to have no fertilization. Fish study also very important. Sometimes we must perform testicular biopsy and genetic transmissible disease as diabetes, hypertension, or cardiac pathologies, hypercholesterolemia disease. So we must and we can help you having you a good realistic genetic counsel. So you must know exactly what it can happen and what we can do. And it has been a very pleasure to share with you, to dedicate you these minutes to the most forgotten infertility, that is the male factor. Thank you, every one of you, and I am here to answer all your questions, if I can, for sure.
Of course, thank you so much indeed for this wonderful presentation, for many, many details, and for explaining all those details as well. And yeah, as you have mentioned at the very end, these male factors are always something that are not so commonly talked about. So I am very happy that we are bringing those topics to you. And you are very right, Dr. Ana. It's time for our questions. So of course, if you have any, go ahead, type those in. Our Q&A session is starting right now, and let's have a look. We do have very first question from the patient. First one: thank you for a wonderful presentation. Could you explain the dynamics of DNA fragmentation, if you've seen this improve, and if given the right conditions, antioxidant support, etc., if it could improve within a 3-month sperm regeneration cycle?
Okay, that's a very interesting question, and I think that the first thing that I must say, that the most important thing when you make any kind of treatment, when you have a DNA fragmentation, is to have time. That's really very important, because people must understand. That's why I start explaining you how the stem cell of the spermatozoid becomes a spermatozoid, And we need this time because men produce millions and millions of spermatozoids, but only very few are really very good. And very few will arrive to fertilize. Nowadays, all of us are exposed to toxic products, to endocrine disruptors that we'll talk next week, we have said. And then those of them, one of the most several things they produce are these DNA fragmentations that doesn't allow this spermatozoa, even he has movement capacity, to fertilize because he lost pieces of proteins. How we can change this condition? Antioxidant support is important, but I think that at the same time that it's very important to give antioxidant, we must choose the best antioxidant in front of the clinical history, the daily habits to eat, how people live, and to take out all the toxics that we can have around us. And that it's enough. When you make a treatment with one antioxidant support, more or less the best thing is to have the first 3 months, then you make a seminal screening, a sperm screening, and you see if you have an improvement. I prefer doing during 6 months because then you can see really if it is the best situation to try spontaneous fertilization or IVF techniques. So 3 months is good, but if you can do it during 3 months, it's better. We also we perform a study here with different hospitals, and we have seen that more than now 9 months using antioxidant, it's not really necessary because it doesn't change anymore. So 3 months sperm screening, 3 months more sperm screening. If there is no change, I don't think that it's better to continue with it. I hope I answered this question.
Wonderful. Thank you so much for the very first question, and of course for your explanation, thorough explanation as well. Thank you so much. Okay, let's have a look. Okay, more questions are coming up. Does male age matter when using IVF to achieve pregnancy?
I don't understand. What do you want to say with it?
So when IVF, yeah,
Yes.
if it's so male age, yeah, does it? I guess it does matter, right? When it comes to IVF, so sperm has to be of good quality either way, right?
Yes,
Exactly.
sure. Yes, sure. It must be the best quality. More even when you have IVF to
Hmm.
use, and you can achieve it, sure. But my recommendation is always we must know exactly in front of which situation we'll have. When I have a patient with more than 45, 50 years old, I like him to do this kind of screening, but he really must know exactly what can happen in the future, even when he makes an IVF to achieve a pregnancy, sure of it.
Understood. Thank you so much for that as well. Okay, and let's have a look at the next question from Giovanni. Thank you very much. I have a question. What do you recommend in a patient with severe teratozospermia, like 0% of normal morphology?
When you have a patient with a severe teratospermia, like a 0%, even less than 4%, you must make him a very good clinical history. Because surely you will find really the reason of it. One little recommendation, very practice, no abstination days before giving the sperm screening. And why? Because in the epididymis, there is a high concentration of toxic products that can change the morphology of the spermatozoa. That's one of the things. And another thing that you must see if this patient have a varicocele. Varicocele is one of the most important reasons of infertility in men and alters very, very badly the morphology of the spermatozoa. So if you have 0% or more, first, first of all, no abstinence days, and you will see that will go higher.
And again, thank you so much for yet another advice, of course. Okay, more questions are here. So do the study findings cited in your presentation apply to all races, ethnicity?
Yes.
All right, easy answer to that one, of course. Thank you so much for the clarification.
So male factors are the same. They're all the men.
Of course, no problem at all. Of course, thank you so much. And let's have a look, okay? Next question is up. What would you suggest if there is 60% of dead sperm cells? What could be the cause of this? And is it still possible to achieve pregnancy naturally? My partner is 36, sorry.
Cat is a lady, no? I imagine.
Yes, I believe so, yes.
What you will suggest there is about the sperm. Here you must really make, I say always the same, medical history, but I suggest you to make a study of infectious of the genital area in the urine and in the sperm. More of them can, of the bacteria, can broken the external part of the membrane of the spermatozoa. I can explain this. Surely he can achieve a pregnancy naturally. And it's the first thing that all of us, all the andrologists, all of the doctors must try. First of all, natural pregnancy. And then if we cannot do it, then we can make technical reproductive techniques as IVF, insemination, etc. I am sure that if your andrologist knows what is happening, you will achieve a pregnancy by natural ways. I'm sure.
All right, thank you so much indeed for that encouraging advice here as well, for sure. Thank you so much. And I'm just waiting. At least at the moment, there are not no other questions. There are some thank yous, of course. However, let's give it a second. Let's see if we have any more other questions. If not, of course, remember that you can ask those questions now, but also you can simply get in touch with the Reproclinic team, and I'm sure they will be more than happy to help you out, as well as Dr. Ana. So let's give it a minute. And yeah, I think someone is typing, so let's just
Yes.
have a second to make sure that we have answered all the questions. Okay, yeah, still typing. Let's give it a second.
All the questions has been really very interesting. That's good to see how patient or persons think about it, because sometimes we are too much scientific and with very little recommendations we can achieve pregnancy naturally.
Yeah, exactly. That is the main problem here. Okay, I think Kat has added one more question. Yes, it is right here. So, okay, smoking is bad, and we all know it. What is your opinion on IQOS products?
What is ICOS products?
This is like you can tobacco. It's like heated tobacco, not
Okay,
smoke. Yeah.
it's smoking really is bad. ICOS products, I don't have seen any kind of studies that demonstrate directly their impact over fertility or fertility rate in men or even in spermatogenesis. I think that we need more time have more information about it.
Okay, so this is still something that we just need to wait a bit more studies to come in. This is still kind of new, and there are more and more of those products coming in as well, I guess. So,
Yes, and the problem that it is true that there are some papers writing about it, but they are not well statistically well done. So sometimes they can have bad opinions, or they say that it's not happening.
of course, understandable. Thank you so much indeed as well. Okay, next question we do have from Giovanni. Do you recommend PGT in males over 45 with young couple in an IVF?
Well, if instead putting 45, you put more than 50, I will tell you yes. Yes, due of the mutation that we can have. 45 years old is a little bit in the middle. I think that it's very important to know exactly how is the health condition of these men. And then you can recommend it or not. 50 years old, sure. Less, we must see what is happening. If he have a lot of toxic habits, what quality life he has, what quality of spermatozoa, spermatogenesis he has, how is his hormones situation, and a history of medicine is very important.
All right. Again, thank you so much for yet another answer. And of course, your question. And let's have a look. Again, someone is typing. So let's give it a second. Make sure that we have another question, I believe. Yes, it's a thank you from Giovanni. So thank you so much indeed. Okay, one more. Okay, from Kat. And when it comes to sperm count, what is a normal range?
Well, there is something very, I really love it to tell it, that the sperm screening, it's not the same as the other sperm screening, because there are range that the World Health Organization says, but normally you must see globally the seminal analysis or screening. We know that we must need 15 to 20 millions per milliliter, 50% with a very good movement, more or less 15% of normal morphology, 50% of a live spermatozoa. But when you have a lot of spermatozoa, an example, 70 millions per milliliter, 200 million of totally, and you have lower quantity of motility, doesn't happen nothing. A little lower. Why? Because you have a lot of spermatozoa. Then you have, if you have less than, you have 45% in this situation of dead sperm, nothing happens. If you have fewer quantity but very good quality, it compensates one thing with another thing. So it's really very important to take care. And another thing that it's really very important is to have more than one sperm screening, because as I've seen all this afternoon, men produce millions and millions, but they never stopped. The seminal tubules are producing another one. So we have to know how the normally sperm count this person has.
Excellent. Again, thank you so much for clarification to yet another question. And there is a thank you from Kat for you as well, of course. So thank you. And sorry, let's have a look. There are two more questions. Is there a specific antioxidant medication you recommend?
Well, that's a question that I always hear, even in the very important medical congress, and I answer always the same. Not all the medications are good. Not having so many quantity of antioxidant medication are not good also. But you must choose the kind of medication by the sperm screening by the way of life of this patient. So we'll have different. If someone never takes fruits, you must give him C vitamin, D vitamin. If someone with very high environmental factors or toxic factors, will give Q10 antioxidant. It depends really what kind of patient and what kind of medical history you have in front of you.
Again, thank you so much for that explanation. And now we will have another question, possibly our final question. So it will be the last call. If you have any more questions, go ahead and type those in. And the question is, here in Africa, environmental factors seem to have adverse outcomes on sperm aspiration. What is your advice on ways to improve results?
That's a terrible question. Not only in Africa, all around the world we have very terrible problems with toxic environmental factors. And I always say, and I will say you next week, what we must do. We must tell to the governments to stop killing the human rights in this question, because human men are really now in a very difficult situation to reproduce themselves. We need IVF. 40% of men have some difficulties to have kids. So really it is very difficult even to know which are those environmental factors that can directly produce sperm alteration. So the first things is to know how these areas, which kind of environmental toxics are, to take them out, and then try to have again a good quality of reproduction. We know a very interesting experience in Central America, that in one banana plantation was using a pesticide that produced abortions. And then we have been studying it, and we could detect which kind of product was. Taking it out, we reconduced the fertility situation of the little village that was near of this banana plantation. I hope that I help you with this answer that is really very, very serious.
Right. Again, thank you so much indeed for definitely interesting question, and of course for your advice on that and your explanation. And yes, as I mentioned, it looks like that was our final question. So thank you everyone for your definitely interesting questions, and of course Dr. Ana for your thorough explanation to all of those. And well, what can I say? There are all the thank yous coming up your way. Thank you so much for a wonderful sorry for answering my question as well. Thanks very much for a wonderful presentation. Another thank you from all the patients. And well, what can I say? Thank you so much indeed. And yes, as Dr. Ana has mentioned, next week on Wednesday at same time, 7 p.m. UK time, we will be back here, and Dr. Ana will be talking about toxins, as she's mentioned, oxidative stress as well. So if you haven't signed up yet, just go ahead and do it. This is going to be an interesting session, I'm sure, as well. And Dr. Ana, anything else you would like to add before we finish?
Yes, I want to add that I thank you, all of these patients, to let them help to have kids. Human people, we are losing natural way of attitudes during the life. And one of the most important to continue being here in the world is being human being. So reproduction is really very important. So thank you very much to let you help by me.
We are very, very happy that you agreed to simply present today. So thank you so much indeed. We are definitely happy to have you on board with the webinars, with all those topics that we have. Thank you so much. And I just want to mention that, as you know, my IVFNs, this webinar has been recorded, so you will be able to find it on the site. It will be available on our YouTube channel as well tomorrow, so you can sign up, and of course that way you know when the new video is uploaded. And again, I can only encourage you to sign up for the next webinar on Wednesday, but as you know, we will be back here tomorrow as well with another urologist and andrologist. So I hope you will be able to join us. This time it will be 8 p.m. UK time. So, well, I hope to see you there. Dr. Ana, thank you so much once again. Everyone have a lovely evening and, well, take care. Bye.
Bye, goodbye.